Hello everyone, today we are going to look on the Occupational Questionnaire Assessment, or well known as OQ. For the introduction, it was developed by Nancy Ruppel-Smith with assistance from Gary Kilhoffner and Janet Hawkins-Watts in 1986. OQ is an evaluation tool based on model that collects information on individuals' time usage. It was also used to record daily occupation for a typical day using 30-minute increments. The purpose of this assessment is to indicate their main activity during each half hour of a typical weekday or weekend, and also to measure time use patterns during a typical day and feelings about time use. The type of assessment is self-reported assessment, while the target population is adolescent and adult. Work, daily living tasks, recreation, and rest are the components being assessed in this assessment. Indications. It is used for a patient that have a good memory and good judgment. Contraindications. Poor memory, poor judgment, unmotivated, and stupor. Now let's move to the administration procedure. Firstly, client will ask to indicate main activity during each half hour of a typical weekday. Then they need to classify each activity according to the component of this assessment. Lastly, they need to rate each activity using a 5-point Likert type scale. Administration time is about 15 to 30 minutes. Scoring procedure. For question 1, calculate the total activity that patient rate for work and divide with all the activity that patient done and time with 100 to make it in percentage. Then repeat the same step for daily living activity, recreation, and rest. For question 2, total all the mark for question 2 and divide with the total of activity multiply with 5, and the same step is repeated for question number 3 and question number 4. For the interpretation, the higher the score, the better individual satisfaction, value, and enjoyment of activity. Now let's look on the demonstration video for this assessment. Good morning, Miss.
Morning.
I am Juliana Ibrahim, your occupational therapist for today's session. So today, I'm going to assess you with Occupational Questionnaire. OQ was used to record your daily occupation for a typical day using a 30-minute increments. So the procedure is, firstly, you need to indicate your main activity and then classify each activity as work, activity of daily living, recreation, or rest. And lastly, rate each activity using a 5-point Likert type scale to indicate personal causation, value, and enjoyment. So do you understand the procedure?
Yes.
So you may proceed to fill the assessment form now. Okay, Miss, based on the result, for question number 1, work, you got 0%, activity daily task, 58%, recreation, 52%, and rest, 9.7%. So, most of the time you spend in daily living tasks. For question 2, 0.41, question 3, 0.46, and question 4, 0.50. So, I think that's all for today's session. Until we meet again in next session. Thank you. Psychometric properties. Test-retest reliability. The result showed that the questionnaire had an acceptable level of reliability, 68% of the typical day activities during the first and second administration. For face validity, this assessment reflects client's time pattern in typical day, client interest in type of activity, and the client's satisfaction, value, and enjoyment of an activity. Content and construct validity. OQ developed for this study provide a more precise method of analyzing the relationship between volition and daily occupation, and therefore enhance the accuracy of comparison between these variables and life satisfaction. Study of concurrent validity using the household work study diary yielded 82% agreement in configuration of activities and 97% and 90% agreement with OQ on how a person classified activities. Advantages of this assessment: it provides a better interpretation of participants' daily occupations, habits, and routines of clients. It focuses on the component of volition subsystem. It has simple instruction and less equipment needed. It has been translated to Chinese, Dutch, French, and Spanish. Disadvantages: OQ was not developed specifically for use with children. It probably underestimated the actual time allocated for sleeping. This assessment took longer time to complete and limited studies of psychometric properties. OQ is suitable to be used in Malaysia because this assessment is not culturally specific. The question is about our daily occupation and relevant to our population. However, there is still no Malay translation of this assessment. Hope this video helped you guys to understand more on occupational questionnaire assessment. That's all from me. Thank you.